Hey everybody! For this video, we're going to be talking about the pipette transfer technique that we're going to be using in class. And when it comes to the pipette transfer technique, really the big purpose of it is simply to transport liquid medium that has bacteria in it to another type of medium, whether that is a solid or a liquid medium. Just kind of depends on the technique that we're doing. But kind of with that purpose in mind, let's talk about the different materials that you're going to need in order to do a pipette transfer. So we are going to need our Bunsen burner, we are going to need the striker because we do have to flame the mouth of our sample. So you'll need a sample as well, whatever your sample might be. You're going to need a pipetter, this little kind of green guy like this, that's the ones that we tend to use. And then you're going to need a pipette, and this can either be kind of a glass pipette or it might be one of these sort of sterile pipettes that we use. It just kind of depends on what setup that we're doing. And just to kind of show the way that our little pipettes actually work out, there are all these little numbers on them, and basically this happens to be a 10 ml pipette, meaning that it can pull up a total of 10 milliliters. So every number on here would indicate 1 ml that I'm pulling up, and if I go all the way to the 0, I would be pulling up 10 mLs. When we are looking at our little disposable pipettes that we have, these are 1 ml pipettes, which is why we tend to use them more in micro. But on here now, each of the little numbers represents a 0.1 ml that I can pull up, and if I go all the way to the 0, I'm pulling up 1 whole ml. All right, you're also going to need something to basically inoculate or something to transfer to. And in this case here, again, there are a couple different techniques that we can use with that in mind. So if you're doing a standard like broth to broth pipette transfer, you would need a broth tube to transport the medium into. And we tend to do this a lot whenever we do serial dilutions, which is a concept that we'll talk more about later in the semester. If we want to do this onto something like an empty petri dish, we can do a transfer like that as well, and this is normally a preparatory step for what we call a pour plate. We can also transfer directly onto the media itself inside of a plate, and at this point here, it's now a preparatory step for what we call a spread plate. Both the pour plate and the spread plate will be covered in separate videos as well. But kind of with our materials out of the way, there are a couple small safety and aseptic considerations that we need to worry about as well. So let's start out with safety. And really the safety part comes into whenever we're using the glass pipettes. So the way that we load our little pipetter is that generally you want to take your pipette, you want to hold it at the base of it, so the part that's going to be going into the pipetter, and then you just kind of gently sort of push it in there, maybe give it a little twist. And now it's in there, it has a nice seal, so whenever we're pulling up our liquid, it shouldn't sort of fall out, because if their seal is broken, the liquid would slowly leak out of the pipette. So that's the normal way that we would go about holding it and then adding it to the pipetter. The safety part to this is that for some reason, students sometimes think that they want to hold at the very end of it, and then they take their pipetter and they really force it really hard into the pipetter. And what we've seen in the past sometimes is that this will basically snap the glass, and then students will impale their hands and basically shove the whole pipette through their hand. So don't do that, right? Don't hold it at the tip, hold it at the base, and then gently again, just kind of force it in there, give it a little bit of a twist, and then we're good to go. So that's really the biggest safety consideration that we have when we use our glass pipettes. Now, in terms of aseptic things that we have to worry about, normally if we're going to be using a glass pipette, we will have autoclaved all the pipettes beforehand so that they can be sterile. And because of that, we generally want to do our procedure kind of quick so that we're not leaving it out to get air contaminants. But if for some reason you have to put it down, normally what we like to do is basically put it so that it sits out over the table. In that way, it's not touching the table itself and it's not getting contaminants from the table on the tip of it. Obviously, another thing is don't touch the tip, because if you're touching the tip of it, you're going to get it contaminated. All right, now when it comes to our little disposable pipettes, there really isn't much of a safety consideration with these. They bend pretty well, so they're pretty hard to snap. And even then, again, they don't stab you quite as much as the glass does. Don't break them either way, though. So the biggest thing here, again, is just aseptic concerns. Big one here, don't open the bag that it's in until you are ready to actually use the pipette. And don't touch the tip of it, don't put it down on the table. Just our basic aseptic considerations with that there. All right, but with our safety and aseptic considerations out of the way, let's go through and do a few procedures. So I'm gonna go ahead and show you a basic broth to broth transfer using our pipetter. And then I'll also do just a broth to plate transfer, but we'll just kind of do it into the, let's say, the empty Petri dish. It's the same consideration to either one. It's just whether or not you do it directly into a Petri dish or on the auger itself. So let's go ahead and get started with a broth to broth transfer using our pipette. So again, we'll start out getting our gas going. Maybe. There we go. All right, and I'm gonna go ahead and I'm just gonna use the disposable pipette for these transfers here. So again, you would start out with your disposable pipette. Go ahead and break open the bag. And once you've broken open the bag, add the pipette to the pipetter. A good way to know which part is supposed to go into the pipetter, they have a little bit of cotton at the part that goes into them. And the big thing here is that this pipetter can pull up 5 mLs. This pipette can only hold 1 ml. So if I just do a really big tug on it, I'm gonna pull a whole bunch of media up inside of my pipetter. So that little cotton swab there is basically to protect it to not get a whole bunch of media in it. All right. So again, break open the bag, add your pipette to your pipetter, and then we're gonna take our sample tube, and this can get kind of messy considering the amount of stuff that we're gonna have in our hand. But we're gonna try to use our same basic aseptic technique. So I'm going to uncap my sample tube, pass the mouth through the flame, then I'm going to take my pipetter out of the bag, then I'm slowly going to dip it into the broth, and then using the little wheel up here, I'm going to basically push down on the wheel. Let's see if I can show you this. And if you watch on the inside of the pipette, about the 4 now there's liquid, and then it comes up to the 3, and then the 2, up to the 1, and now up to the 0. So what I have effectively done is, again, I have taken about 1 ml of my broth out of my tube. One thing that can happen when we do this is that if you take the pipette and you push it all the way to the bottom, it does create a vacuum down there, and then you're not going to pull up anything until you lift the pipette and then you pull up a whole bunch. So make sure that you only have it down about 80–90% in the medium when you actually start using the little wheel to pull it up. Another thing I kind of want to show as well is that is the amount that I pulled up. That's how far up that I pulled it in order to move 1 ml. So again, don't yank on it a lot. It's going to be a nice slow process. All right, so where were we at? Break open the bag, put the pipetter in it, uncap your sample tube, flame the mouth of it, dip your pipetter in here, or your pipette in here, and pull up 1 ml. We're going to flame the mouth of my sample tube, and I'm going to recap it. I'm then going to take my broth to inoculate, so my inoculation tube, uncap it and flame the mouth of the tube. And now what I'm going to do is I'm going to push this button right here. And if we're looking at it, when I push this button, you can kind of see the media starts flowing down inside of the pipette. Basically, this releases all the pressure, and now what I can do is just wait for all the media to be gone, and then I'm just going to push on the top. And by doing that, I ensure that I have extra air inside of the pipetter to fully squeeze out all the media inside of my pipette. All right. Reflame the mouth of your inoculation tube, cap it, then go ahead and put your pipette back in the bag, take it out of the pipetter, and now you can biohazard the pipette. So those would be the steps that we take when we do a broth to broth transfer using our sterile pipette. Now let's go ahead and do a broth to a plate transfer. So I'm going to use the same pipette. So again, I would start out, I would break open my bag so that I can get the pipette out. Put the pipette into the pipetter. Flame the mouth of my tube. Insert my pipette. Pull up my 1 ml. Flame the mouth of my sample tube again. And then now what I'm going to do is I'm simply just going to take the lid off of my plate. I'm going to push the button to deposit the liquid into the plate. Squeeze the top. And put the lid back on it. Can then put my pipette back in the bag, pull it out, and then biohazard it. And then I am done with that procedure. All right. But really, that should cover what I need to cover for our pipette transfer technique.